Welcome to the Radiology Review Podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome back to the Radiology Review Podcast. On this episode, let's take a brief break from the questions and answers, and let's talk about the ABR certifying examination. I recently posted an article that I wrote on the Radiology Review Journal about the ABR certifying examination and what you should know. I want to cover much of this content in this podcast episode as well, so those who would prefer to listen to this can do so, and those who would, on the other hand, prefer to read the article, you can find that at the Radiology Review Journal at theradiologyreview.com. Without further ado, let's discuss the ABR certifying exam, what you should know. As an early career radiologist, I took and passed both the ABR core exam and the ABR certifying exam. I did not take the older oral and written ABR exams, although I did see residents only a few years ahead of me prepare for those older style exams. Many of the Radiology Review listeners and readers have recently passed the core exam, and congratulations to all of you. By passing the core exam, that means by default that in the near future, you will take the certifying exam. The purpose of me talking about the certifying exam is to describe key differences between preparing and taking the core exam versus the certifying exam, and I do hope that this is helpful for many of you. Let's start with a question. Is the ABR certifying exam easier than the ABR core exam? Thankfully, yes. I found the ABR certifying exam to overall be less time-consuming to prepare for and be a somewhat easier examination than was the case for me with the ABR core exam. Myself and others I have discussed this with have found that the magnitude of preparation necessary to pass the certifying exam was a fraction of that necessary to pass the ABR core exam. Now, please don't misunderstand. You do need to prepare for the certifying exam. However, the timing of the certifying exam generally will require most test takers to have a more streamlined approach for preparation. I took the certifying exam only a few months after I started as a new assistant professor at the Mallinckrodt Institute of Radiology in St. Louis. This was a fantastic opportunity, and given that starting my career required that I spend most of my available time and mental bandwidth on my new career, I simply could not afford studying the same number of hours for the certifying exam that I had spent on the core exam. It is possible that most of you future certifying exam test takers may also not have the luxury of vast amounts of time to study for the certifying exam. A key message for future certifying exam test takers is this. Do not despair if you are extremely short on time to study for this exam. Nearly all of you will have completed a radiology fellowship by the time you take the exam, and a radiology fellowship will sufficiently prepare most of you for a large portion of the content you will be tested on the ABR certifying exam. Let's summarize a few key points about the certifying exam. As of August 2021, when I am recording this, the certifying exam is administered as soon as 12 months after completing radiology residency, according to the ABR website. The website also states that the exam allows 5 hours to complete 274 questions, and it is currently administered twice yearly on a remote basis. I took the certifying exam in person at the Chicago Testing Center, so I cannot tell you from personal experience about the remote exam. If any of you have feedback or would like to share some of your insights about the experience of taking the certifying exam remotely, please send thoughts to theradiologyreview@gmail.com, and I will consider posting this under the Radiology Review Journal. And I refer you now for a more complete description of the ABR certifying exam to the ABR website, which you can find easily online. Next, the ABR certifying exam is not the same for all test takers. Unlike the core exam, where everybody is tested on very similar content, with the certifying exam, you have the indulgence of choosing 3 subspecialty areas of focus. These are referred to by the ABR as clinical practice modules. These can be 3 different subspecialty areas if you choose. Alternatively, 2 or even all 3 of these clinical practice modules can be the same subspecialty area. Therefore, a neuroradiology fellow may choose all 3 clinical practice modules in neuroradiology. Now, if you select 2 or 3 modules in the same subspecialty area, you will be given advanced questions per the ABR. If you choose only one subspecialty area for a clinical practice module, you will take the easier fundamental questions only. In my case, I completed fellowships in both nuclear radiology and then subsequently women's imaging, and I therefore chose one section of nuclear medicine and would have received fundamental questions for that. And I selected 2 sections of breast imaging because that was more fresh in mind at that time. And therefore, I would have taken advanced questions for breast imaging. And the great thing about how I structured the exam with 1 nuclear medicine section and 2 breast imaging sections is that mirrors my subspecialty practice. And I think that is what the ABR designed this exam to do, is allow you to select those areas that most closely mirror what you will do on a day-to-day basis in clinical radiology. Additionally to the 3 sections you select, the test will also present a section called Essentials of Diagnostic Radiology. And basically, the Essentials of Diagnostic Radiology section will test knowledge that all radiologists should be proficient in, regardless of your subspecialty focus or general focus. In addition, the Essentials of Diagnostic Radiology section also contains non-interpretive skills questions. And that is right. You are not done with non-interpretive skills questions after the core exam. You will again visit the ABR Non-Interpretive Skills Study Guide to help you prepare for this portion of the certifying exam. The exam additionally presents the second portion of the radioisotope safety exam, which is also termed RISE, R-I-S-E, radioisotope safety exam. If you did not know that the radioisotope safety exam was part of the core exam, well, it was, and hopefully you passed that. And you also need to pass the section on the certifying exam to officially have passed the RISE exam and receive RISE certification, which can be especially important if you want to become a nuclear medicine authorized user. According to the ABR website, as of August 2021, the RISE questions are focused on clinically oriented practice scenarios. Let's move on. How did I prepare for the certifying exam? My primary preparation for the certifying exam was completing fellowships in the areas I selected for my certifying exam clinical practice modules. Having completed a fellowship in these areas, I felt probably 80 to 90% prepared for the types of questions I received. My secondary preparation was self-study, for which I used online question banks. I reviewed portions of key texts, which in my case included things like nuclear medicine requisites and the ACR BIRADS Atlas, and I also reviewed in detail the most recent version of the ABR Non-Interpretive Skills Study Guide. If the Radiology Review podcast that you are now listening to had been in existence, I would have also used this and listened to nuclear medicine and breast imaging and non-interpretive skills episodes. In my opinion, Crack the Core, which will come to all of your minds when I talk about radiology board exam preparation, was not quite as useful for the certifying exam, at least in my case, and especially for the more advanced questions on the certifying exam. I feel like Crack the Core probably would not be quite as detailed as they could potentially test. And I believe that is probably the case for most of you who are doing at least 2 or even 3 areas in the same subspecialty. However, Crack the Core still may have some value for you, and particularly if you choose 3 separate subspecialty areas for the clinical practice modules and will only receive the essential but not advanced level questions, Crack the Core may be sufficient to help you prepare for those. However, in divergence to the way I studied for the ABR core exam, I barely cracked open Crack the Core for the certifying exam. It's up to you to decide if you think it will be helpful. I'm simply sharing my own experience. What about question banks, or Q banks as we call them? I found Q banks to be helpful, not only to identify areas of potential weakness and review key material, but I think the Q banks and going through the motions of taking multiple choice questions can help you improve your multiple choice test taking strategy and expertise. For example, I had to remind myself to read the question stems in entirety, so I remember specifically taking Q banks and missing some questions, and that drove home the fact that I cannot neglect to not read the question stems completely. So use Q banks to review material and use Q banks to hone your multiple choice mindset to maximize your chances for success. I personally use Board Vitals almost exclusively for studying for the certifying exam. The other Q banks also certainly offer material that can be very helpful. I did like that Board Vitals had sections that included essentials of diagnostic radiology for the certifying exam, and I did take all of those questions, and it helped me feel better that I had prepared for that section. Next question. Did I specifically study for the Essentials of Diagnostic Radiology section on the certifying exam? The answer is yes, I did study for this portion of the exam with a caveat. When I started studying for the exam, I decided that I would need to review some key material in each subspecialty area to make sure that I am prepared for that section. I also used Q-Bank questions on Board Vitals that I mentioned that were designated for this particular purpose, and I also took questions that included non-interpretive skills and RISE, and I found those to be at least moderately helpful, if not more. Now, like I said, I did initially start to review diagnoses I assumed would be high yield that I had not encountered recently, such as things like the age of intracranial blood products on CT or MRI, names and patterns of various kinds of skeletal fractures that I had not seen for several months or even a year, different types and causes of bowel obstruction, and so forth. As I spoke with others who had recently taken the certifying exam, I received some advice that I did consider and I did partly implement. The advice was that essentially it's impossible to restudy all subspecialty areas with the amount of time you have available to study for the certifying exam. And therefore, if you are picking and choosing from each subspecialty area, what are the odds that what you pick and choose to study will identify a specific topic that will end up being tested on the exam and is something that you didn't already know? When I considered this, I realized that it was not entirely feasible for me to review all radiology subspecialty sections for this one single section on the certifying exam and expect to substantially boost my a priori performance. You already spent 4 years learning this material. You probably already know much of what they will ask you, and extensive additional studying here may or may not identify areas that you didn't already know that will end up being tested. Once I realized that, I did take all the questions on Board Vitals on this subject of Essentials of Diagnostic Radiology. I made sure I understood everything that was asked there, and I especially focused the majority of my available study time for the Essentials of Diagnostic Radiology portion of the exam on the Non-interpretive Skills ABR study guide and the RISE portions of the exam. And what I can tell you is that this did work out for me. Now, I am not telling you to not prepare for this portion of the exam. I would never do that, but I am saying be strategic. Next question. How did I study for the non-interpretive skills and the RISE portions of the exam? For the non-interpretive skills section, I used the most recent ABR non-interpretive skills study guide from the ABR website, and I would refer you to that as well. That is simply the best source there is to learn this material, and it is straight from the ABR. I have covered and condensed some of these non-interpretive skills topics on prior podcast episodes that you can find and listen to at the Radiology Review or your favorite podcast directory. For the RISE questions, I read the last chapter of Mettler in Mettler's classic nuclear medicine textbook, and that was very helpful for both the core and certifying RISE questions. I highly recommend that you either read in your own copy of Mettler or borrow a copy of Mettler from somebody else to review the chapter that discusses radioisotope safety. I also took QBank questions on these topics. Last question. What parting advice do I have for you, future certifying exam test takers? First, I would suggest that you request time off from your new employer to take the exam. If in-person testing is somehow reinstituted in the future, request sufficient time so that you can travel to the ABR testing center in sufficient time to have a restful night's sleep the night before you take the exam. Because I did take the certifying exam in person, as this was pre-COVID, many test takers waiting in line with me or staying at the same hotel that I was at had discussed that they were not automatically given time off for travel, and at least one of these individuals was on call the evening before the exam and ended up taking a red-eye to Chicago on the night before the exam, which is not ideal. It is probably best to not be on call the night before the exam, so work this out with your new employer in advance. Arrange your schedule with your employer accordingly. The ABR certifying exam also has a registration fee, and if you need to travel, there are travel fees associated with this exam. Consider asking your new employer to cover these costs as part of your initial employment negotiation prior to signing your employment contract, assuming these expenses are not already covered by your employer. I would suspect that in many cases, your employer will agree to A, give you time off for this exam, and B, help you cover expenses, especially if you ask for these before you sign your contract. My next piece of advice is to ask recent test takers you know about their experience and advice pertaining to the certifying exam, and that is especially important for those taking the exam remotely because I did not take the exam remotely, so I cannot speak to this portion of the exam at this point. Finally, take the certifying exam seriously. However, this exam also may not need to take over your life to the same degree that the core exam may have taken over your life. I suggest that you study consistently during your fellowship training to learn the subspecialty material, not only for the certifying exam, but for your future clinical radiology practice. Then fill in the final gaps during the months prior to the exam. Perhaps listen to a few of my radiology podcast reviews that are pertinent to your certifying exam. And as always, prepare to succeed. For those of you listening who may be taking the certifying exam in September of this year, I wish you all the luck with this examination. I suspect that you will come out successful in the end. That concludes this episode. Thank you for listening, and I will catch you on the next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.